So, let's talk about a really critical tool in home healthcare today, the HHCHAPS survey. We're going to break down exactly what it is, how it all works, and most importantly, why it matters so much for patients, clinicians, and the agencies they depend on.
It's a pretty tough question, right? So much of what makes healthcare great isn't something you can just see on a medical chart. It's all about the human side of things.
Exactly. I mean, when someone is caring for you in your own home, feeling respected isn't just a nice to have, it's everything. But how on earth can a big healthcare system actually measure a feeling like that and, learn from it? And it's the same thing with feeling heard, right? Knowing that your worries are being taken seriously and that you're not just a patient, but a partner in your own care. Well, these are the experiences that really define the quality of care, and it turns out there is a structured way to measure them. And that's where the HHCAHPS survey comes into the picture. It's basically designed to give a real, formal voice to all those essential, personal feelings about home healthcare. So HHCAHPS stands for Home Healthcare Consumer Assessment of Healthcare Providers and Systems. Yeah, it's a mouthful, so we're just going to stick with HHCAHPS. What it really is a standardized official survey. It systematically captures the patient's point of view, making sure everyone gets asked the same questions in the same way.
But here's the most important part. The whole point isn't just to collect a bunch of data. This feedback becomes a direct roadmap for agencies. It shows them exactly how they can improve their care day in and day out for every single patient.
Okay, so how does this whole thing actually work in practice? Well, for the data to be something you can trust, agencies have to follow a really clear set of rules.
For an agency to participate, it's a pretty clear 6-step process. First, they've got to be Medicare certified and agree to be part of the program. They also need at least 60 eligible patients. That's to make sure the results are statistically solid. Then, they have to follow super strict rules about how the survey is administered and how the data is sent in, all while making absolutely sure that patient confidentiality is protected. And, this strict process is what really gives the survey its power. It means that when you see HHCAHPS results, you can trust them. The information is consistent and reliable, whether that agency is in California or Maine.
All right, so we've covered the why and the how. But what are patients actually being asked? What are the questions that really get to the heart of the home care experience?
I mean, just look at how simple this question is, but think about how deep it goes. This isn't just asking, did a nurse explain things? It's about clarity, it's about empathy, and it's about making sure the patient feels totally in the loop every step of the way.
And here we are again, back to that core idea of dignity. This question directly measures that feeling we talked about right at the start. It's a really powerful window into the culture of a home health agency.
Now, this one's all about teamwork. From a patient's perspective, care can feel pretty chaotic if the nurse, the therapist, and the aide aren't all on the same page. This question gets right at whether the care felt seamless and coordinated.
So, beyond those really core questions, the survey also digs into other vital areas, like was the care plan actually explained clearly? Was medication handled safely and effectively? And of course, it asks for that all-important overall rating of the entire experience.
So, once all this data is collected, where does it actually go? Well, the answers to these questions create this incredible ripple effect that spreads across the whole healthcare system. This feedback makes a huge impact in 5 key ways. It helps agencies improve their own quality, and of course, it boosts patient satisfaction. It also creates public accountability, because these scores are often public. It can even affect Medicare reimbursement and help shape national policies for home health care down the line.
So who actually benefits from all this? Well, patients can use this data to pick the best agency for them. The agencies themselves get this actionable report card that tells them exactly where they need to focus, and policymakers, they get the real-world data they need to build a better system for all of us. It's a total win-win-win.
When you put all these pieces together, one big idea really stands out. The HHCAHPS survey isn't just some form to fill out. It's a tool for collaboration.
At its heart, what this survey really does is create a structured conversation. It takes a patient's individual experience and turns it into a powerful collective insight. It empowers clinicians and agencies to listen, to learn, and to get better. It truly builds a partnership in making care the best it can be.
And that really leaves us with a final thought to chew on. The whole idea behind the HHCAHPS survey is that the patient's voice isn't just a part of the story, it's the key to unlocking a higher standard of care for every single one of us. It really makes you wonder, what would we achieve if we treated feedback that way everywhere?